So this is a technique for the Glen humeral joint. So we're starting off with a fixation tape, and our points of reference are going to be inferior angle of the scapula. It's going to travel over roughly mid-clavicular line and then go down towards the top of pec major, the top hip. And our distal anchor point will be over the top of the deltoid tuberosity. And we're going to wrap around roughly around half the circumference of that soft tissue. Now, in terms of patient positioning, then it's important that they maintain a position of slight abduction. So a hand on the hips, ensure we've got about sort of 30 to 40 degrees abduction, and that will add tension to the tape when we apply our zinc oxide. So with our further strips of fixation mesh, then we want to get really good coverage and covering over the deltoid muscle, and we want to use all of the anchor points. So our first one will run straight up the middle, starting distally and then attaching in towards our proximal anchor, and then we're going to spread the rest of them out using all the different anterior and posterior portions of both of our respective anchor points. So our next one will overlap roughly about half, and then bring that up towards the top. And I've got one more posterior strip. And just ensure that you're above that axillary fold, otherwise you'll start impairing your patient's flexion or shoulder flexion, which you want to try and avoid. We've got two more anterior strips. And these are going to be positioned following the anterior portion of deltoid. Start distally, bring it up, and attach into hip. And one more strip. We're using 5 here, but it may be need to use 3, might be need to use 7, will depend upon the size of your patient's arm. Right, so you can see we've got a really good coverage or covering of our fixation mesh. We're using all of our respective anchor points, so we haven't got an accumulation of tape at any fixed point, and we're now in a position where we can start applying a rigid tape to the shoulder that will really offer the support that we're after. So we're now using 2-inch zinc oxide tape, and we're going to simply follow these strips going distal to proximal, and you can apply tension if you feel you need to. So our first one, start right in the middle of deltoid, add tension through the tape, distal to proximal, straight up the middle. And the same with the strip just behind it. So make sure it's properly stuck down. And our last 2 strips, okay. So this needs to be closed off, otherwise these end points will become detached and it won't be offering the support that we need. And because if it's a patient perhaps undertaking sport or putting that shoulder through quite a broad range of movement, then we need to make sure it's really effectively closed off. So using fixation spray would help, certainly beforehand, or by applying some closing strips over the top. And because we want to offer a lot more support, I'm going to go over twice. So the first closing strip is going to go over the top here, and then I'm going to put one more strip to offer a bit more support for the tape at the top. And the same at the distal end. So we're enclosing off all those strips of zinc oxide tape, 2 closing strips just here, and that should offer the support that our patient needs to support their glenohumeral joint.